I started smoking really young. I've been a smoker since I was 14 years old, and I'm 40 now. I come from a really small town, but once I went to college, well, there were other gay people there, and they all smoked. By the time I was smart enough to realize what was going on, well, I was already addicted. It's even damaged the relationship between my non-smoking partner and I.
In America right now, 1 in 5 people are smoking. In the lesbian, gay, bisexual, and transgender communities, we have smoking rates that are almost 70% higher than the general population. And why such extremely high smoking rates? In the LGBT communities, the stigma that we experience can nudge anybody towards unhealthy behaviors.
Coming out and not knowing what my life was going to be like, I smoked a pack of cigarettes every day.
It's easy to fall into the trap of smoking. So many LGBT people are already so stressed out about coming out or just living their daily lives.
You experience the isolation from your family, from school members. You're looking for social acceptance.
Add to that the additional stressors of being discriminated against or having your rights denied because of who you are and who you love.
And I think that's what's been capitalized off of. You're not normal, here, have a way to relieve that stress.
We're targeted by the tobacco industry because we're a very easy population to sell to, and we pay them back in decades and decades and decades of handsome profits to their bottom line.
Because it looks like they care about us, because they're sponsoring our events and they're running ads in our magazines, and it's a lie.
Smoking is everywhere. It's part of the fabric of our communities. It's also the #1 preventable health problem that we can steer clear of.
We all have a role to play in being activated for health justice.
And it's going to take a lot of work at a lot of different levels. First step is we need to help the LGBT communities realize we have this huge smoking disparity.
And knowledge can kind of strike the match, but in order to keep the flame going, there has to be support mechanisms within the community.
Part of this solution is going to be our own community members standing up and demanding to be included in health programs that are working on tobacco.
As a smoker, tobacco makes a lot of the decisions for me. I don't want to have to feel like I have to go smoke because smoking has that control. I want to be able to say, I can do what I want.
I have now been smoke-free for about 15 years. Quitting smoking was incredibly liberating. It's time to make a change and save our community and save our own lives.
I've spent 26 years listening to nicotine instead of myself. Yeah, it's time to quit.